Seeing a sudden change in your child's face is one of the scariest things a parent can go through. So today, we're going to talk about one of the most common reasons this might happen, Bell's palsy in children, so we can really understand what it is and, just as importantly, what it isn't. And let's be honest, this is the first thought that rips through your mind, isn't it? Is my child having a stroke? It's a totally understandable fear. I mean, we've all been trained to see a facial droop and immediately think stroke. So when it's your own kid, your brain just jumps to that worst-case scenario. Okay, so let's walk through how this usually begins. The signs can be kind of subtle at first, and it's often a parent's sharp eye that catches the very first clues right there at home. You know, one of the first things you might notice is during a moment of big emotion. Maybe they're laughing at a cartoon or having a little cry, and you suddenly see it. One side of their face just isn't moving with the other. That big, beautiful, symmetrical smile suddenly looks lopsided. And this weakness isn't just about expressions. It can show up in really practical ways, too. Mealtime can suddenly become messy. You might see them dribbling milk or water from one side of their mouth, simply because they can't get a tight seal with their lips anymore. So beyond the really obvious facial droop, there are some other subtle clues to look out for. Your child might suddenly complain that sounds are way too loud. You might notice them tugging at one of their ears. And definitely keep an eye out for a red eye. That can happen because the eyelid on that side isn't blinking enough to keep it moist. And here's a big clue. A lot of the time, this all happens right after they've gotten over a cold or the flu. All right, so you've seen these signs, and now you're at the doctor's office. It's a really stressful place to be for sure, but knowing what's coming can make a huge difference. So let's talk about what the doctor's going to do. Now, the words neurological exams sound really serious, right? But for a kid, doctors are absolute pros at turning it into a series of games. They'll ask for their silliest pufferfish face to check the muscles, they'll watch them play with toys, maybe even pop some bubbles. They might do a little tickle test on their face to check sensation. It's all about getting the info they need while making the child feel as safe and comfortable as possible. And then the doctor's going to have a really good look inside their ears and mouth. This step is so important because they're looking for other things that could cause this. You know, like a bad ear infection or a condition called Ramsay Hunt Syndrome, which is related to the shingles virus and can also cause facial paralysis. In some situations, they might run a few simple tests just to rule out other possibilities. Doctors sometimes use a little mnemonic to remember them, BLUFF. B is for blood tests, to check for infection. L is for Lyme disease tests, especially if you live in an area with ticks. U is for a urine sample to check for rare issues. And F is for fluorescin. That's a special eye drop that helps them see if there are any tiny scratches on the surface of the eye. So after that thorough checkup, after ruling a few things out, the doctor is starting to get a much clearer picture. And that leads us to the diagnosis. Let's dig into what Bell's palsy actually is. So what is Bell's palsy? At its heart, it's a temporary weakness on one side of the face. That's it. It happens when the nerve that controls all those facial muscles, it's called the seventh cranial nerve, gets all swollen and inflamed, usually after some kind of virus has been through their system. The two words you really want to hold on to here are temporary and one side. Okay, now this is probably one of the most important things to get your head around because it helps separate Bell's palsy from something much more serious. With Bell's palsy, the weakness affects the entire side of the face, all the way up to the forehead, so a child won't be able to raise their eyebrow on that weak side. That's a huge clue. In many strokes, the forehead muscles are actually okay, so that's a key difference. And as you can see, other red flags would be weakness on both sides of the face or any weakness in their arms or legs. And here it is. This number is probably the single most reassuring thing for any parent to see. Somewhere between 70 and 90% of kids with Bell's palsy make a full, complete recovery all on their own, usually within a few months. The prognosis is overwhelmingly positive. So you've got the diagnosis. Now what? Well, the focus completely shifts to recovery. And the great thing is the management plan is really straightforward. It's basically a simple 3-part plan that you can manage right at home. This 3-pronged approach is pretty simple. First, you've got to tackle the symptoms, usually with some medication. Second, and this is so important, you have to protect the eye on the affected side. And third, you need to provide that emotional and psychological support, helping your child through this temporary change. So for that first part, symptom resolution, doctors will often prescribe a short course of oral steroids. These are just powerful anti-inflammatory medicines that help bring down the swelling around that facial nerve, which gives it a chance to heal.
Sometimes, if they think a specific virus is to blame, they might add an antiviral medicine too.
Okay, part 2, eye care. And I really can't stress this enough. This part is absolutely critical. Just think about it. We blink thousands of times a day without even noticing, and it keeps our eyes clean and moist. When that blink reflex is gone, the eye is just exposed. So that means using lubricating eye drops during the day, and a lot of times gently taping the eyelids shut at night to protect it while they sleep.
And that brings us to the third piece of the puzzle, which is just as important as any medicine, the emotional side of things. How do you explain this to a little kid? Well, this is a really wonderful, gentle way to put it. Their smile isn't gone forever, it's just been borrowed for a little bit, and it's going to come back soon.
So finally, let's look down the road a bit. The best news, like we've already said, is that the outlook here is fantastic. But there's a typical follow-up plan just to make sure everything is healing exactly the way it should. So what does follow-up look like? Well, you can expect a few check-ins with your family doctor, maybe every week or two at first, just to see how things are going. Then usually a specialist appointment a month or so later. And of course, the big one is safety netting. You go back right away if any new symptoms pop up, if the eye starts to hurt, or if you see a rash developing. And that really leaves us with this final, crucial question, doesn't it? Because beyond all the medicine and the eye drops, this journey is also about taking care of your child's spirit. It really makes us think about how open conversations, support from their school and friends, and just constant reassurance can make all the difference in helping a child feel happy and confident while they wait for their smile to come all the way back.